Hello everyone, I'm Dr. Rajkumar, Director Research Oncology at MedGenome, Bangalore. So today I'll be talking about the future of medicine, especially as applied to oncology, and how it is going to be impacted by genetic testing. Now, genetic testing per se means testing the different genes which we have to see whether there is a change in the alphabetic code of DNA. We have 4 alphabets as far as DNA goes. So this is A, C, G, T, and these are strung along to give rise to the sequences in the different genes. There are 3 billion or 300 crores of this alphabets strung to make up the DNA. Now, when we do the genetic testing, we are going to be looking specifically as applied to cancers. We are going to look for what we call as disease-causing mutations or disease-causing changes in the DNA sequences. Now, there are 3 primary areas of application. Number 1 is what we call as germline testing. So this particularly refers to hereditary cancers. So as an example, there are hereditary breast and ovarian cancer families, and these are associated with 2 genes importantly, BRCA1 and BRCA2. Now one can do genetic testing to see whether the mother or the grandmother who has already had breast cancer has any mutation in these 2 genes, a disease-causing mutation in these 2 genes. If they were to have the disease-causing mutation and they already have the cancer, then there is a 50% chance that they could pass on that gene copy to their children. Now, every gene we have 2 copies. One comes from the father, one from the mother. So that's why I said 50% chance for the mother to pass it on to the children. Now, if we detect a disease-causing mutation in, let's say, BRCA1, there is an increased risk for that person, for the, let's say, the child, or maybe a young lady who could be at a greater risk for cancer. But this risk is not absolute. What I mean by that is if there are 100 women with the same disease-causing mutation, 50 to 70 of them would develop the disease during their lifetime. So conversely, 30 to 50% of them may not develop the disease. So there are factors other than this disease-causing mutation which are at play. And we try to bring about lifestyle changes, etc., to reduce that risk further. So even if they were to have what we call the carrier status, carry one abnormal gene in let's say a mutation in the BRCA1 or BRCA2, there are preventative measures which can be taken up. So this is number 1. Number 2 is with regard to the tumor. In every tumor, now we find that people are doing what we call as genetic testing. Now this has a major impact in deciding on the treatment. The conventional approaches has been usually surgery, chemotherapy, radiotherapy have been the standards of care, and now more recently immunotherapy also has come into the play. Now here we will find that by doing a gene testing, and if you do find in the tumor mutations in different genes, some of these mutations we have drugs targeting them. So this is called as personalized medicine. So you do the specific, that is, you do the gene analysis using what we call as the technology called as next generation sequencing, and identify mutations in important genes for which there are therapies available which can target those mutations. Using that, we can then bring about specific management changes for that individual who carries the mutation. Along with this, for immunotherapy, now we have an assay which is called as looking at tumor mutational burden. So this essentially looks at how many mutations are there in a given sequence of the tumor. So that is something which we can actually do as well. And this can decide whether the individual will benefit from immunotherapy, especially immune checkpoint therapies. And for this, usually the responses in those who achieve a good response, it's excellent. But this is going to be seen in around 15 to 20% or 25% of the patients. And finally, you can follow up the patients in a much better manner. And for this, we would be using the blood, and in the blood we separate what we call it the cell-free DNA. We do this cell-free DNA and look for the mutations which are present in the tumor itself, the original tumor, and see whether they are present in the cell-free DNA, and then use that as a monitoring marker. Thank you.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.